In this video, we'll be talking about the reproductive health and the use of the contraceptives. What is meant by reproductive health? Reproductive health is actually proper maintenance of healthy reproductive organs. It also refers to the methods by which we should prevent or we can prevent the sexually transmitted diseases or STDs. So STDs are actually sexually transmitted diseases or the diseases which are caused due to the sexual act. These diseases are also known as venereal diseases. These diseases can be transmitted very easily, and viruses and bacteria are found to be the most causative agents. Now, for the bacterial infections, we have two very common examples. The diseases which are caused by bacteria are gonorrhea, and syphilis. These diseases are caused by the bacteria which are commonly found. Then we have certain diseases which are passed over during this sexual act, and these are caused by the viruses. The two examples are warts and HIV/AIDS. HIV/AIDS is still a dreaded disease which cannot be prevented properly. So methods should be adopted so as to avoid these kinds of diseases. And when we talk of the prevention can be prevention of STDs can be done by use of condoms. The condoms prevent the entry of these causative agents, thereby preventing the STDs to a certain extent. The use of copper T is not advisable over here because it will not be able to stop the entry of these two, the causative agents, and therefore it is not considered to be effective against the many kinds of STDs. So proper care should be taken so as to prevent these kinds of diseases. Coming to contraception or contraceptives, when we talk of contraceptives, contraceptives actually these are the methods or the devices which are being used to avoid pregnancy or not to have the pregnancy. It can be for various reasons. That means if a couple does not want to have the baby or to maintain the gap between the babies, then these methods are highly useful. Now, when we talk of contraceptive, what is an ideal contraceptive? First and foremost is it should be easily available. It should be effective. Also, it should have no side effect, no or less side effects. And preferably reversible. So these are the points which are for an ideal contraceptive. So contraceptive will be talking about various kinds of methods or devices which are used for contraception, that is avoiding the pregnancy. Now the first method over here which we will be talking is the physical or barrier method. The physical or barrier method, it is found in both, that is males and females, and over here it is actually providing a mechanical barrier so that the sperms do not meet or fertilize the egg, because for the pregnancy to happen the egg must be fertilized by the sperm, or in other terms if we say, the sperm must meet the egg for the fertilization to happen. So if it can be protected or if it can be avoided, pregnancy can be also avoided. So these are the barrier methods, and over here in this we have the condoms, which are very common. It is used for both males and females. It provides the barrier and does not allow the sperms to meet with the egg. The second important are the cervical caps. These cervical caps are for female only. These are for female, and they block the cervix, thereby not allowing the sperms to enter. The second important method is the chemical method. That is, we use the oral pills over here, or the chemicals. So these are the oral pills over here, and these oral pills actually change the hormonal balance or of the body. As a result, the egg formation does not take place, and since the eggs are not formed, no fertilization can happen. So actually the oral pills will not allow the formation of the egg, and as a result the pregnancy is avoided. The third important method is the use that is the surgical method, or surgical method. Now surgical method actually is the method where we use surgery, and in case there are two ways, one in male and the other in female. In the male it is known as vasectomy, that is males, and tubectomy, it is in females. In vasectomy, surgically the vas deferens of the male is blocked. As a result, the sperms which are formed in the testes are not able to move, and they are not able to reach, they will be blocked. Tubectomy, over here the fallopian tube is blocked, and as a result the egg will not be able to reach the uterus. So over here, if the fallopian tube is blocked, the sperm will not be able to meet the egg because egg is not reaching the uterus over here. And vasectomy, the mature sperms are not able to move beyond the vas deferens. So here vasectomy, vas deferens is ligated or cut, and tubectomy, here the fallopian tube is blocked. These two are important methods, surgical methods. Then the other method is IUDs, the use of IUDs or intrauterine devices. The intrauterine devices can be utilized only for females. These are the methods which are only for the females. Now over here, it is the most common type IUDs. And here there are certain structures like the loop or the copper T. These are simple plain devices which are introduced or which are placed in the uterus so as to prevent the pregnancy. So what there are, these four are the major methods where we can avoid the pregnancy. Now over here there are certain side effects of the chemical methods, because when a person uses the oral pills, it disturbs the hormones of the person, and therefore certain kinds of side effects may happen. But in spite of that, it is being used extensively. The IODs are used and commonly used, and they are reversible. That means when the couple wants a child, these can be removed and the pregnancy can happen. So therefore, these methods are extensively used for maintaining the or for avoiding the pregnancy and to control the population. Now, when we talk of the reproduction process, it is though very important, but overpopulation can uh, result into lot of problems for the society. Therefore, contraception is very important.